It's my ability to connect with that child, to make them feel relaxed. Even if that means physically, I got to get down on their level, or let's sit on the carpet for a minute. And then my other tool that I bring out, of course, is whatever art materials I have. Typically music, like a xylophone or a glockenspiel, whatever you call it. Some sort of musical instrument is always a pull, right? They want to play it, they want to bang it, they want to be as one. And then also it's not really getting straight to the issue, depending on the age of the child. It's not really getting straight to the pain of the thing. It's really spending the first couple of sessions just getting to know who they are. You know, like I try to be a kid, right? It's one of the first things that we all forget as we get older is play and imagination, right? So that's what I try and tune into, especially with the young ones. The ability to focus. That's a big deal for a lot of parents, and they really want their kids, and it mostly has to do with being in school, right? Holding their attention, being able to focus. In addition, another big one is the arts will allow you, we show you different techniques using your body to de-escalate, to regulate your emotions. And I think also for kids who have a problem communicating with other kids, it's really also about finding an alternate way to say what they feel, if that makes sense. You know, sometimes there are kids that come to me, parents who come to me, and their children just have social anxiety, like they freeze when they have to speak. And that's one of the first things I try to attend to. This is another way that you can say what you feel without having to talk it through. Sometimes talk therapy is not effective because it puts a lot of pressure on kids, right? To be able to articulate and express what they're feeling, difficult. The first thing I say is that, you know, you're 99.9% successful just by showing up, just by reaching out, just by making that call. A lot of people have stigma around therapy, and a lot of that has to do with how it will look to others. I think one of the best things that you can do as a parent is try to exhaust all your options. You know, if the help that they get possibly in school from a guidance counselor is not enough, a therapist will be able to dig a little bit deeper with that child, and always having in mind that compassion and empathy. So the same empathy that I have for the child, I'll have for the parent, right? And I have to say, it also helps to be a parent, you know, as a therapist, if you're working with kids. Parents like to know that they have something in common with you, you know, when it comes to working with their child. But yeah, there's a lot of reluctance, I think, by some parents because they've reached the point where they don't know how to help. They've come up against something that they're not sure why their child is in having an extreme breakdown or meltdown, or why they have, you know, heightened sensitivities towards smells or textures. And I think parents come because they want to have some sort of definition to what their child is experiencing. And they also want to know, like you said, is it my fault? How have I contributed to this? And I think I take that in a very tender approach because not every parent is in the state of mind or has the resolve to kind of hear what might be contributing to their child's behavior, right? So you kind of have to give them a full scenario of the possibilities.